Welcome and thank you for joining us today for this webinar on EMAC, a basic understanding and use of the system by public health and medical professionals. This is the first medical and public health webinar that we've conducted, and we're already working on a follow-up to this webinar. This first webinar focuses on the basics of EMAC. In our next webinar, we're going to be focusing more on the state-level implementation of EMAC. We'll be sending all the attendees from today's webinar an invitation to the second webinar once it's available. My name is Angela Koppel. I'm the EMAC Program Director at the National Emergency Management Association. I'm pleased to present Leon Shaifer, the EMAC Senior Advisor. Leon is retired from Mississippi State Emergency Management Agency, and I can attest to the fact that there's no one in the world more qualified and knowledgeable about EMAC than Leon. So I'm very pleased that he's going to be able to present to you today. Leon, I'm going to turn the webinar over to you now.
Well, thank you, Angela, for that welcome, and welcome everyone to the first of two webinars that NIMS is presenting. This particular webinar today is going to be addressing the basic aspects of EMAC, and it's intentionally designed to present you as health and medical professionals with a broad overview of the EMAC process so that you may obtain a better perspective on how you can effectively utilize the EMAC system whenever it would be to your advantage to do so. The second webinar, as Angela's already mentioned, is scheduled for presentation on Thursday, March the 10th. It will focus more closely on the actual EMAC experiences shared by three of your colleagues, Kathy Robinson and Mary Slayers from the Department of Health, North Carolina Public Health Regional Surveillance Team, and Mary Dooley from the Connecticut Department of Public Health. Both of these ladies chair the NIMS Medical and Public Health Typing and Prevention Working Group. So let me begin by briefly defining for those of you all who may be unfamiliar with EMAC at this point, exactly what is it. EMAC is an interstate mutual aid agreement. It's entered into the states, enacted into the state law of all member states, and it allows the sharing of resources across state lines as long as there is a state of emergency or disaster declared by the governor of that affected member state. EMAC law is composed of 13 legal articles, some of which remove legal barriers that typically would prevent movement of publicly owned resources across jurisdictional boundaries, and establishes immunity, liability protection, and workers' compensation, and licensure, certification, reciprocity. We'll touch on some of these more thoroughly as we go through today's webinar. Let me point out before I move on that EMAC owns absolutely nothing. The resources are owned by the EMAC member states. EMAC is only a system. It's used by member states in which to legally move resources across state lines. Today's objectives are going to really focus on several things. Once we want to realize the importance of pre-event preparation, the things that we can do that will help expedite resources among affected states. These include the development of mission-ready packaging. We want to discover how local emergency response through EMAC is triggered. We want to understand how EMAC resources are requested and how they are offered. We want to be aware of what to expect when deploying through EMAC system as deployed personnel. We want to understand the overall reimbursement process for deployed personnel and resource providers, as well as those requesting and assisting states. Okay, let's look at the five-phase process of EMAC. It involves pre-event preparation, activation phase, a request and offer phase, and then we get to the response phase, and we look at really three stages there. There's a mobilization stage, there's a deployment stage, and then, of course, a demobilization stage, and then we finalize the process with the reimbursement piece. So first, let's look at pre-event preparation. For public health and medical personnel, that includes quite a number of different things. Completing EMAC training courses, developing and coordinating response plans and procedures, and especially networking with state and local emergency management officials, exercising those specific plans and procedures, developing mission-ready packaging, and addressing licensure and credentialing issues. So under the EMAC training and exercising piece, we want to look at several things. We'll review the materials that's available for you on the EMAC website, and you can do that at your convenience. You will find there that we have quite a number of offerings up there. For example, we're doing webinars now, but there are also webinars that we've done in the past that are there. Angela spoke to those a moment ago, how you can go and review those and view them at any time at your leisure. We also have a course that the Emergency Management Institute at Emmitsburg, Maryland, that FEMA provides for us. It's called the Understanding EMAC course, or E431. I encourage you all, if you're interested to know more about EMAC, to sign up for that course and come spend 4 days up there with your peers and other disciplines from across the country to really get into how EMAC works. And we culminate that experience that week with a really good exercise on how it all comes together. We encourage you also to look at exercising as a real tool for honing those skills that you pick up doing the training piece. Schedule and conduct exercises on an annual basis, not only within your own department, but integrate those exercises with other departments and other disciplines as well. For mutual aid planning, there's really two types of planning that we look at here. There's intrastate, there's interstate, and then you have the interstate piece. Today we're really going to focus on the interstate piece, because that's what EMAC is all about, is moving the resources across state lines. But there's also a very key part of that whole preparation piece for the interstate movement, and that involves developing these resources for use more day-to-day on an intrastate basis between cities and counties that are more readily affected by emergencies of that type. The key to this mutual aid planning is to establish a good working relationship with state and local emergency management officials. It's important that we ensure that legal authority is in place in each one of our member states so that all available resources, whether they be private, public, volunteer, can be legally moved as agents of the state, as according to the EMAC Articles of Law. We want to organize our resources under the tutelage or under the sponsorship of these state organizations so that they are readily identifiable and readily available for whenever they are needed on an intrastate basis as well as an interstate basis. Typing and credentialing of resources using the NIMS standards that have been posted out there are critical in developing mission-ready packages, for example, and also looking at cost estimates that are associated with those packages is a very key, important item. Building the capacity to deploy and operate on a self-sufficient basis, with or without logistics support in some particular areas you go to. It may be required based on a particular scenario that might occur. And we ask that in this mutual aid planning piece, that as these capabilities are being prepared and developed, that they keep in mind to being ready to deploy both on an intrastate and an interstate basis to meet whatever those requests may be. Resource providers have a really key effort in facilitating all the support we have here by providing mission-ready packages to the assisting state EMA that contains a specific resource capability to perform a very unique mission containing cost estimates and other resource details that we'll discuss when we get over into the mission-ready package methodology. Now, most of you are familiar with the NIMS resource typing. It's been around for quite a number of years, and they have quite a number of resources that have been typed and put up on their website. This is a definition for resource typing that comes directly from the NIMS Resource Typing Center. We look now at developing the mission-ready package. The mission-ready package, as we envisioned it several years ago when the concept evolved, it's really the next step towards NIMS typing. It takes that effort and it takes it to the next step and makes it more operationally adaptable to most situations. Let's look at the steps taken to develop a mission-ready package. There is information to guide you along this process, and you will find it on our emacweb.org website. This is a screenshot that shows you how that presently looks. If you go to that website and click on the tab Mutual Aid Resources, you will see this page. And down there where we have this box highlighted, there's a element entitled Mission Ready Package Models. And if you click on that first bullet there where you see over 114 models of disaster response mission packages, you will find behind there in one of these models the kind of information that will give you some heads up, somewhere to go to help organize your thoughts in terms of putting together these resources. Let's say, for example, you wanted to look at the components of a basic life support package. or life support transport package. You would simply select the number for that package that appears on the menu. In this particular case, it would be number 53, and you scroll down to that, and this is what you will see. The basic life support transport package. And it has certain elements in there that define task and purpose and the amount of personnel that are required support. It gives you a mission identification of what it can do, what its expectations are, the equipment involved, and the limitations, which are very special, and some other special instructions that help there with some of the logistical needs and that sort of thing. The resource cost estimation, though, is one of the most important elements of developing these packages. And you will notice here that there is a single figure, estimated dollar cost figure, at the bottom of the page. It's shown here in white. But the other data listed is, therefore, easily transferable over to the form I'm about to show you next. So we look at this discipline-specific mission-ready package as really good guidance is provided for that particular resource. This particular short form is used as guidance in putting together a more broader, if you will, resource package. Now, currently, many of our NIMS working groups are using this particular form that will provide mission-ready package guidance to their particular constituents. So the other data, as I said, it's easily transferable over to the next form. This information is easily transferred and over to the mission-ready worksheet template, which you now see. We're going back to the same web-based page, and now you scroll down below the mission-ready package models, and you see another box. That box identifies the template that we used for use in the longer form, if you will, of putting together a mission-ready package and the cost estimation templates. Now on the same web page, for example, your package you want to develop will not exceed 25 persons. If it exceeds more than that, then you have a selective Excel workbook in which you select. But in this particular example, we're going to show what a 25-person MRP would look like. You simply scroll down to that, click on it, and you will see a page that looks like this when you go to that workbook. This particular workbook is in Excel, and it shows you an example. I know it may be hard for you to see it, but it is an emergency and critical care package specific to that particular resource need. The cost estimate forms are integrated into this workbook. And as you can see, there are tabs at the bottom of the page that will lead you to specific work pages where you can enter in cost for certain categories that may be associated with the particular package that you're trying to develop. Just by clicking on those and going back to those particular fields. The data fields on the MR worksheet are very unique to this particular purpose. Where the short form identifies some of them. Also, you will see that we begin to add more fields for more information using this longer form. For example, you have a field for the mission-ready package title. You have the resource owner information there, contact information, who that individual is by name, to help identify who is in charge of that particular resource if that resource is ever needed or needed to be called up. There's details on resource capabilities, what it can do, what sort of logistical footprints are needed, how large a space is needed to operate in, what kind of support is needed maybe from other interests. And it also contains the cost estimates for travel, personnel, equipment, commodities, and those other expenses. The MRP worksheet itself is composed of 2 worksheets, and it contains 20 fields of specific information, as you can see. The tabs for entering personnel are also located at the bottom. In this particular screenshot, you see one that would lead you back to, on the left-hand side of the screen, the tab for the travel. On the right-hand side, that is what that travel tab looks like when it pops up. And it gives an opportunity to enter in all sorts of information that is relative to travel. Now, of course, it would be very difficult to fill in travel information during the phase 1 preparation because you probably wouldn't know where this particular resource is going to be deployed to. But by filling out the personnel, the equipment, the commodities, and the other costs associated with deployment of this package, that can be done pretty easily because it's fairly well standard cost, or it doesn't really depend on where you're going. There's no variables in there. like travel does. But once you get a request for that information, a request for that resource to be deployed, then it's a small matter of time engaged to go back and put those travel costs together once you know where you're going to. So there is a lot of time saving in doing this before the fact rather than waiting doing the fact. We show you this because developing a cost estimate has a couple of really good benefits. Number one, it ensures a real speedy deployment of needed resources because you've done a lot of the preparation, a lot of the detail work before the fact rather than during the time that you're trying to put this information together. And it provides a really good reimbursement package to simplify the repayment for those mission expenses that are incurred when that resource is being deployed. Okay, let's shift over now and look at the next phase of the EMAC process, the activation phase. This is not a lot involved here, but be aware that in order to activate the system, the EMAC law requires that the governor of the affected state must declare a state of emergency, and then that state can open up an event on the EMAC operations system. At that particular point now, they can begin to request assistance from other member states. Now, this is what the emergency operations system looks like for a member state to enter in an event and get an event number for that particular entry. And it's important to know this because every request that the state that opens up an event log and gets that mission number, that event number, every mission associated with that event from that state or by that state carries that tracking number along with it. Now, this is probably arguably the most important phase in some people's viewpoints in the entire process. This is the request and offer phase, where resources that are needed are being requested and being provided or offered at this particular point. And they use the REQ-A form in order to do that. The EMAC REQ-A form, or the Request for Assistance form REQ-A, is the only official form that's used by member states, and it's used by member states only, in order to request, offer, and accept assistance through the EMAC system. Now, EMAC member states can certainly make EMAC requests from other states on behalf of their political subdivisions or any other legitimate stakeholder, EMAC stakeholder, who might need assistance not available through intrastate or pre-disaster contracts or other means. This is one of the selective measures that member states have at their disposal or in their resource box, if you will, to bring resources to bear to help overcome shortfalls by any of their affected jurisdiction partners. We also require that only one specific mission be written per one REQ-A for tracking purposes and identifying any particular problems that might occur requiring an amendment later on during the deployment process. This particular REQ-A becomes the sole basis for financial reimbursement of EMAC resources. It is a three-part form that constitutes a legally binding contract whenever duly executed by those state EMAC authorized representatives, who incidentally, by law, happen to be positionally named the EMA director, the emergency management director of each state. There are others who can be appointed by this individual as long as they have the express authority under state law to obligate state resources and state funds for that purpose. Now, I mentioned a moment ago how important it is that states during this pre-deployment stage know what their legal authority is and how to maximize use of all available resources. And that can be done through model intrastate mutual aid legislation that NEMA has provided to all of our member states. And at this particular point, quite a number of them have enabled this legislation so that they do have a really effective and efficient intrastate resource sharing network through the intrastate system. It only makes sense that if this is done on an intrastate basis, that moving these same resources across state lines in time of need of a major disaster of some type is really simplified on an interstate basis if they have a really good intrastate network in place. It's really important also to know that EMAC law states that for purposes of tort liability, immunity, and workers' compensation that all EMAC deployments through the EMAC system, or all personnel deployed through the EMAC system, must be legally authorized to do so under their specific state authority as agents of that state. This especially applies to the typical non-government personnel such as individuals from the private or the volunteer sector. Now, requesting and state actions here's a glimpse of how some of these actions taken by requesting and assisting states during the request and offer phase. Let's look at this just for a moment. Here on the left-hand side, you can see the affected requesting state identifies its resource shortfalls, and it lists those on Section 1 of the REQ-A, and it makes a request for assistance from other EMAC member states. Now, at this particular point, the potential assisting states receive that request. They contact potential resource providers who may be capable of providing that assistance, and the potential resource provider then determines if it's within their capability and if the requested resource is available. And if it meets those particular situations, it transmits a mission-ready package worksheet, if it exists, and we say if it exists, hopefully it does, back to the assisting state for action. If it does not, but yet the capability resides there, then the potential resource provider has to go through a little time-consuming process for putting together cost estimation and looking at other limitations and other logistics support and things of this type. So you can see the comparison in terms of time saving if this particular piece of work is done before the fact rather than during the time the request is actually made. The assisting state then completes. They receive the information from the resource provider, and they complete Section 2 of the REQ-A. And it contains the MRP. It can be attached to it, or it can be integrated into that particular piece of work. And it transmits that data back to the requesting state for consideration. Now, the requesting state now receives that offer. They look at it, they evaluate it, and they accept or reject that offer based on what their operational needs are or what their operational considerations are at the time the request is made. And if those needs are met, the offer is accepted. The requesting state authorized representative will sign off on that Section 3, accepting the cost and accepting the terms of the offer, and that's put on the REQ-A, and it's immediately transmitted back to the assisting state. Now, here the assisting state receives it and immediately notifies the resource provider to prepare for deployment, and it issues a mission order authorizing their deployment, meaning to that resource provider that we are going to be financially responsible for meeting your mission-related expenses that are detailed in this request for assistance. Now we move over to the response phase. And here, remember, we have three different distinct and separate stages: the mobilization stage, the deployment stage, and the demobilization stage. So first, let's look at the mobilization stage. This is where preparations are taken by resource providers as well as deploying personnel prior to deployment, getting ready, standing up, putting together quite a number of things. And as you can see, some of the actions that are recommended here, there's always a normal course of business that's been scheduled. There could be activities, there could be other travel, there could be other types of training perhaps going on, or other meetings or something scheduled that has to be taken care of. Those responsibilities either have to be postponed or passed along to somebody else. There has to be established a mobilization time frame. How much preparation time do we have before we launch that resource? We want to make sure that there are travel arrangements made, hotel accommodations, ground transportation, whatever is needed to provide that logistical wherewithal to get those resources moving and functioning. There's gathering of personal items, clothing, needed supplies in order to do the mission. There may be medications that might have to be acquired as well. Essential equipment, part of a push package or a go package. And then it's a good time to remember that during this particular period of time to look at the mission-related expense documents that may be required and begin to track and document time and costs that are relative to the mission that might be turned in later for reimbursement. An important part of this whole mobilization process is getting that pre-deployment briefing. Before deploying, personnel should be given a pre-deployment operational briefing provided at the resource provider level by the resource provider with information matriculating down from the assisting state. For example, it's important that deployed personnel know all about the mission-related information. What's going to be happening? What are you going to be expected to do? What sort of logistical support do you have to take with you, or will you be provided once you get into the affected area? Don't leave home without your mission order. Your mission order meets quite a number of responsibilities. Number one, under the NIMS credentialing piece, it is your invitation to enter into or be allowed to enter into a disaster area. There may be a situation where a state can give out a credit card and all expenses documented on a state credit card, or a cash advance if that's legally authorized in some states. And then finally get a good understanding and briefing on the expense and travel reimbursement policies of that particular resource provider and the assisting state, so that if they require a lot of documentation, that you learn about it before you launch rather than getting back after you've already incurred expense and don't have the documentation to support those costs. Let's spend a moment at the mission order. The EMAC mission order authorization form, or mission order, contains the exact identical information that's shown on that REQ-A, with the exception of cost estimation and all the personnel information. It contains the detailed mission descriptions, point of contacts, and other types of information that's really relative to the conductivity of that mission. And it also serves as that individual's invitation, as I said a moment ago, to be allowed into the affected area in compliance with current NIMS credentialing guidance. Okay, let's look now at the deployment stage. The deployment stage involves actions taken by deployed resources in order to perform the mission or to render the services in the requesting state as defined in their mission order. Upon reaching the designated point of contact, the individuals or the package or the whatever is being sent there to perform a service reports to the designated area that's shown on that mission order for in-processing. If there's a case of credentialing or licensing or certification requirements, at this particular in-processing station is where those matters are identified and authorized in order to practice within a particular state. And then there we move on to the duty station and perform the services identified on the mission. Notify the assisting state's emergency management agency, who, by the way, you are operating as an agent of that particular state and that particular agency. So they need to be notified that there's that the resources arrive. You want to, of course, notify your resource provider. In other words, that resource provider could be your boss. You want to let them know that you have safely arrived. And, of course, don't overlook notifying your family that you've arrived and how you can be reached in case there's a problem at home that you need to take care of or be aware of. You want to verify your mission assignment. Has there been any changes in the status of the operation since you have been mobilized? Has things changed? Are the priorities still the same? Are we still engaged in life-saving or triage, or are now we moving off into some other phase of the mission? You need to know these sorts of things so that your effectiveness won't be mitigated. Then you want to carry out that assigned mission for the length of time that you are there deployed into that particular state. And during the course of your deployment, you want to maintain contact with all applicable parties and let everything know that things are working as they should be. Now let's look over here to the deployed stage provisions. Deployed personnel, these are under law. It's important that you know this. The EMAC law allows these extra provisions that you are under the operational control of the requesting state's assigned agency. You are under the operational control. You take missions from them, taskings from them, but you remain under the command and control of your normal authority. Whomever you are responsible to and who you answer to at home, you remain under their overall command and control, even though you're deployed out of state under an EMAC mission. You take mission requests through the requesting state's incident command structure. And you are subject to recall at any time in order to protect your home state's citizenry first. And this is a provision under the law. It's called limitations. So every state, every member state is called upon to make a due diligent effort to help out another member state, as long as it does those resources that they're going to provide are not needed at home to take care of home people first. Okay, let's look at the expectations that can that can be surrounding some of our deployments. Here's some expectations that could be experienced by deployed personnel. In some cases, has already been experienced. But this list has been generated from after-action reports from those that have been gone before you. And here's something we want to look at. You may and likely will run into limited communications, or maybe even no communications. Some of the conditions might require you to be self-sustaining, taking your own shelter, taking your own food and water, and so on and so forth. You're going to be dealing with traumatized residents and co-workers. Who knows, you may even be counting yourself among that number temporarily. You can always count on long working hours. You can always expect limited sleeping accommodations. And the weather conditions may be totally unlike anything you've ever envisioned before. You could be going to another part of the country that you're unfamiliar with and not be environmentally protected from that. So you need to know all these informations up front so that you won't be surprised when you get to the field. In some cases, you may find that field conditions are highly primitive. Living in tents, if you're even fortunate enough to have tentage, it could be other conditions as well. Depends again, of course, as you can imagine, on the disaster scenario itself. And then finally, you could face potentially cash-only sustainment. So be prepared to take cash with you, even if you have to take your own cash and be subrogated by your resource provider upon return home when the mission is over with. Because power outages sometimes may prevent ATMs from working, or other cash systems could be down as well. Now, there are occasions where there may be an amendment or issuing a new REQ-A may be required. Let's look very briefly at those. An amendment to a REQ-A may be required when there's an up or down change, if you will, that may affect the estimated cost of the mission you're performing. For example, you may have been told that lodging and food provisions are going to be provided for you when you go into a locale, only to find out when you go in and get in-processed into the state that those provisions are no longer available. And now you've got to provide those luxuries, those creature comforts for yourself. And that's going to make those estimated costs go up because they were not included on that REQ-A. Or if your tour duty changes. For example, you may have been deployed for a 2-week period of time. It's been a long time into the mission, and the requesting states decides 1 week into your mission that they're not going to require you to be there for 2 weeks. And so you're going to be redeployed back home after only being in state for a week. So that's going to cause a downward shift in those cost estimates. And then if you have some equipment repair or replacement that was not anticipated when the REQ-A was being completed in the front side, all of a sudden now you may have some large additional cost on the end of it. And all those situations require amendments. On the other hand, a new REQ-A is required whenever there is a change in the mission's assignment or a change in the mission description that is on your mission order. For example, the team is asked to perform a service that is entirely different from the service that's stated on the mission order, but yet they're competently able to perform that mission. But it's not the same mission that's on that mission order. And if they want to do that other mission while they're there in state, it's going to require a whole new REQ-A because there's a definite change in the mission that's on that mission order. Or if there's an existing team, or if the existing team is being replaced by another team on a rotation basis, then of course each team will have to have a REQ-A for that cover situation. Okay, there's no comment on this. We're now moving from deployment into the demobilization stage. Excuse me. And this takes place, of course, under several situations. Demobilization can occur whenever the original mission has been completed and services have been provided, or either the requesting state or the assisting state requests and both subsequently agree to terminate the mission for any reason. And finally, operations are being downsized and assistance is no longer needed. That will all lead up to the need to demobilize and return back home. Here are some of the recommended actions that we suggest to take place during this particular short phase. In other words, verify that the mission has been completed and that all party states are in concurrence that it's time to demobilize. You want to coordinate your demobilization plans with both the requesting and assisting states. Remember, you are an agent to one state, but you are under the command and control of the other. So you want to be sure to keep both of those involved in that decision. There may be some material or some equipment that you checked in or used during the course of your deployment from the requesting state. You want to make sure that those are returned. You want to inventory all the equipment that's a part of your package and make sure it's operational and it's all accounted for. And you want to begin to verify your mission expenses and make sure that you've got all the appropriate documentation to justify you being reimbursed for the expenses that you've incurred in order to perform that mission. And then finally, of course, make sure that you have adequate travel arrangements for your trip back home, and those arrangements have been shared with not only family, but your home state resource provider. Now, when you get back home, there's always some follow-up things to do as well. These are some responsibilities that deployed personnel should not overlook. Number one, when you get back home, you compile the documentation on the amount of expenses that you incurred to perform that mission. You prepare and submit a timesheet, travel vouchers, and other types of documents that your resource provider may require. It could be a trip report or some sort of a after-action report or something or another that would go along with that particular package. You want to assist the resource provider in any way possible in order to compile expenses for equipment use and contractual expenses that you had to utilize while you were deployed, so that it expedites that reimbursement process and that audit process. Okay, resource providers, in other words, your boss, if you will, if you are not the boss in this particular case, have some responsibilities as well to make sure you understand what your home state travel policies are and what their unique requirements may be for you. Communicate with deployed personnel and the assisting state emergency management agency officials during the course of your personnel's deployment to find out if everything is working well, to be that liaison between those two bodies and to make certain that everything is well and everyone's safe while they're deployed. You want to keep copies of all the documentation that's being sent to the assisting state for consideration. And then you want to conduct an audit of the reimbursement package before you send it up to the assisting state EMA for consideration. Therefore, you can catch any shortfalls in documentation or paperwork before it gets up to the state consideration and having it pushed back, thus delaying your reimbursement. Let's look at some eligible costs. Remember now, if the MRP, the mission ready package, is prepared, and if you remember what we talked about briefly on the request for assistance form, you will find these basic categories for reimbursement that constitute eligibility. For example, there's travel, equipment, commodities, other costs, and personnel. Now, the personnel engage a lot of different information. There's salary, including overtime, regular time, overtime, and fringe benefits. The salary is normally calculated at a regular rate that's used by the assisting state or its political subdivisions and other entities who may be providing assistance. That's where that information comes from. An authorized individual may must sign timesheets and payroll documents and work records attesting to the fact that those submissions are legitimate and were mission related. Your travel costs also include airfare and receipt from airlines or travel agent that lists the name of the traveler, the dates of travel, and the cost of travel, and any baggage handling fees or anything of that nature, which is becoming some more prevalent these days and times, is necessary. Boarding passes actually show, even though they're not a basis for reimbursement, it shows that the individual actually, did complete that trip. Ground transportation includes the cost of a taxi ride, and of course receipts are required. You can use private-owned vehicles or personal-owned vehicles. Mileage rates are determined by GSA rates, and this website there, I'm sure most of you are familiar with how that's determined. I understand here recently they've gone up from the 50 cents, I think it's 55 cents now. Cost for government-owned vehicles, which is based on receipts only, not for mileage or any cost other than the actual receipt for using a government vehicle. In a rental vehicle, one has to be rented with fuel required. You must have a contract showing the name of the renter, coinciding with the mission documentation, and the dates of the rental must coincide, of course, with the mission dates of the mission order. Any fuel receipts to provide gas and oil for that vehicle during the course of its deployment. Lodging expenses can be either at a per diem rate, or they can be actual cost for lodging. And if there are actual costs for lodging, then receipts are required. And this must be pre-identified on that REQ-A in advance of deployment and agreed upon by both party states. You will find, perhaps in some future situations, where per diem rates are more preferable because they're less involved in determining travel costs, where actual costs are just making certain that the individuals who are deployed make sure they come back with the lodging receipts necessary to justify the cost. Other travel costs include meals, and the same applies here. They can be on a per diem rate, or they can be on cost of showing actual receipts, and agreed upon in advance. Now, one thing is critical to mention at this particular point. If you are being deployed using per diem rate, or if you are on the cost-based rate, and you get there and your mission order states that you are self-sufficient, you're dependent upon yourself for food, and yet you get there in a particular area down where work is being performed and other workers are being fed either through one of the volunteer agencies active in disasters, Salvation Army, Red Cross, Baptist Brotherhood, or those that provide food on a gratis basis, and you get free food, you should make a notation of that when you get back, because it would be improper to be reimbursed for food costs that you didn't incur. Equipment costs involves such things like maintenance and operating costs for vehicles required during the mission. It's described on that REQ-A. You must have log sheets showing the hours equipment was used, documents that substantiate the fuel and oil cost, and documents showing any damage in case there was damage incurred would be necessary. Commodities include such things as supplies, consumables, and materials that were used in the mission as described in the REQ-A, and these are all reimbursable. But it requires good receipts and good records. Other costs involve such things as repair and replacement costs of equipment that may be damaged during deployment, costs for decontamination of equipment that was not foreseen ahead of time but may require some substantial cash outlay to put it back in a post-deployment condition when you return home, cost of purchasing and transporting supplies from the assisting state to the requesting state, cost to return equipment back to a pre-disaster condition, and replacement cost of damaged or destroyed non-equipment items that are all based on whether or not they're mission-related and are categorically listed in some manner on the mission or the REQ-A. Ineligible costs, of course, some of them are quite obvious. Replacement of items that were expended prior to deployment is ineligible. Costs for personal use items, alcohol, tobacco, toiletries, those kind of disposable things that are not mission related. Unspecified costs that are not verified by receipts. And backfill costs for personnel coming in to fill in someone on a shift who's being deployed, unless, of course, they've been agreed upon up front and it's listed on the REQ-A and agreed upon by the authorized representatives. Credit card statements alone are not eligible basis for determining cost. You must have the actual receipt itself. Cost incurred by individuals who choose to self-deploy or self-dispatch. They are not reimbursable under EMAC. And other costs not for items not specified or indicated on the REQ-A. Or items that might be purchased outside of that tour of duty date, when the beginning date and the ending date that is shown on that REQ-A. Now, here's some helpful tips for those persons that may be deployed at some point in time. These are just basic statements. If a REQ-A does not include a cost for a particular item or category, you may not be reimbursed for it. And communications with your home state is essential throughout your entire mission, so that if anything irregular shows up during the course of your deployment, then you have a daily basis or a daily routine communications link with your home state to get clarification on how to handle it or directions on what you should do about a certain thing. It's easier to correct a situation at the moment it occurs rather than waiting days or maybe a week or even after the post-deployment. If any part of your mission changes, remember, an amendment to the REQ-A may be required. Also, it's a truism. There's no such thing as too much documentation. And I know most of you all are probably chuckling over that as I am every time I look at it. There is no such thing as too much documentation. In other words, the job is never done until the paperwork's done. I know you've heard that many times. Your home state may ask you to provide even additional documentation. All right, let's shift over there and look quickly at the reimbursement package itself. Now, the reimbursement package contains an intrastate reimbursement form, or what we call an R2, reimbursement 2, and it's only to be used by at the intrastate reimbursement level between resource providers, not deployed personnel, but the resource provider, the agency or the department or the level of government that is deploying that individual out of state. That R2 is used at that particular level to capture mission expenses, and it, along with the supporting documentation to substantiate those expenses, are sent up to the assisting state for action. And that supporting documentation that I just alluded to contains a number of things. It contains timesheets that were generated by the deployed personnel, work records that may be generated by the resource provider, along with payroll documents, travel expense reports and vouchers, which may be generated by both, and copies of warrants and checks, which are only generated at the resource provider level, and receipts for any invoices for purchased goods, which has been turned in by deployed personnel. All of this documentation is considered a viable piece of that supporting documentation. Now, here's some basic principles of reimbursement that are generally inarguable. For example, assisting state audits the reimbursement package and pays the resource provider before they submit the reimbursement package up to the requesting state for consideration. Now, this is if laws and in-state procedures allow them to do this. The requesting state is legally obligated under the EMAC law to reimburse each assisting state for all eligible deployment and mission-related costs on the REQ-A. EMAC reimbursement process is based upon generally acceptable accounting principles, or GAAP procedures, if you will, but audit needs vary from state to state. So there may be some additional questions or some additional requirements from different states, but these are generally acceptable across the board. Reimbursement claims should be well documented, and they must follow EMAC and jurisdictional procedures to simplify the reimbursement process. Speaking of the process, here we are. We're at the final fifth phase of the reimbursement process, and let's just look now at how this whole thing further works. Deployed persons are demobilized, and they return back home. They put together their timesheets, their trip reports, invoices, meal costs, all of those things we talked about just a moment ago, and they turn it in to the resource provider for whom they work. It's no different, or should be no difficult, than the same requirements that are incumbent upon personnel when they return back from a normally or regularly scheduled government business trip, or a convention, or a conference, or a training course. The same process at this particular level. The resource provider looks at it, and if there's no other questions and every dime is accounted for, then they issue a check back to deployed personnel, and the deployed personnel out of the picture. But it's important to know that the entire reimbursement process starts with that first deployed team or individual that returns back home. Now, the resource provider has some additional information. They've got all the data that's been turned in by the deployed personnel, plus they have the council check for those expenses, and there may be some payroll records that they generated in order to pay the deployed personnel, and they put those together and on a R2, if you remember, the intrastate form, and they send it all up to the assisting state for consideration. The assisting state looks it all over. There's no additional information required, then they write a check to the resource provider. At this particular time now, the resource provider and the deployed personnel are paid, and they're returning back to normal activities. The onus is now on the assisting member state to take all the documentation that's matriculated up to them on this particular mission and package it up and send it to the requesting state for action. The requesting state performs the same audit and overview, and if it all meets the audit smell test, if you will, then they write a check. Now that process is concluded. Okay, let's quickly look over at the summary piece and just see what we've talked about for today. And you'll remember we talked about experiencing an effective deployment under the EMAC requires preparation in phase 1, and it also requires commitment to do these things when there's time and when there's not an urgency involved around preparing mission-ready packaging and doing some of the training and exercising and things of that type. Public health and medical professionals and their resource providers can ensure EMAC mission success at any time by understanding and being able to apply the EMAC process, as we generally talked about and discussed this morning or this afternoon, by developing, training, and exercising EMAC procedures, organizing capabilities into those mission-ready packages using the short or the long form, networking with peer organizations to build additional capabilities and to share this information among your peers so that readily identifying where resource capabilities reside is simplified during the time of need. And more importantly, to address any differences that may surface or arise or be identified in the licensure and the credentialing standards that exist. Knowing what to expect when deploying under EMAC and how to prepare for those expectations or to offset, mitigate some of the shortfalls of those expectations by knowing up front and addressing and building your packages to address those. And finally, following EMAC reimbursement policies and procedures to help expedite everyone getting paid in the process. Well, this concludes this session on understanding and using the EMAC system by public health and medical professionals. I personally thank you for allowing me to present this to you this afternoon and for your taking time to attend this webinar session today. I remind you not to overlook the information that's forthcoming on the second webinar on March the 10th. Be willing to look out for that. We hope you'll tune in for that. I hope the information that we've shared with you today has been helpful to you. And if there's no other questions, and Angela, I'm going to turn it back over to you to close out today's session.
All right, Leon. Well, we have a couple of questions for you. The first question is the REQ-A cost the same as the cost in the mission-ready package?
Not necessarily. Remember, we use the keyword several times throughout both explanation on both processes, and it's called estimated cost. The EMAC law is pretty specific about reimbursement. It says that all eligible expenses incurred by one state to provide a service or assistance to another state is considered eligible. Of course, that depends heavily on those basic things that we talked about a moment ago. It has to be mission related, it has to be documented, and it has to be verified and substantiated in order to be reimbursed. But you can make a swag, if you will. You can put together some cost. But we always ask the question anytime something surfaces during a mission about a particular cost or any other provision that's being provided the question is, what does the REQ-A say? And if it says we estimate these costs to be so many thousands of dollars, that is not hard and fast. It is certainly dependent on the final documentation for that. So it's really incumbent on both parties. Number one, the resource provider, i.e. assisting state, must do a really sufficient job of documenting those costs so that every dime that has been expended on behalf of providing a service is going to be reimbursed.
Okay. Can states send volunteers under EMAC without workers' compensation and liability protections in place if the volunteers agree that those will not be covered?
That's a very good question, and I think the way it's stipulated, the way the question was read, I would probably agree that they could be sent under those conditions. Here again, I would state the same as I stated in the previous question. What does the REQ-A say? There's nothing in the compact legally that requires a cost of service in order to provide a mission. Matter of fact, it does provide a gratuitous approach to it, if you will. In other words, a state can provide a service to another state at no cost at all. So those two statements, I think, would substantiate that particular individual's question.
Okay. Is there a cost associated with obtaining a mission-ready package, and where do we get it?
Is there a cost obtaining a mission-ready package? Was that the question?
Cost of obtaining a mission-ready package, correct.
No, there's no cost whatsoever. As a matter of fact, NEMA has developed that template free of charge. It's on the public side of the firewall, as I indicated. It can be pulled down onto your desktop and used at your convenience to develop, any capability you so desire. Do not try to complete that template online. It just will not allow you to do that. You must download it to your desktop first, and then it's yours, and you can do whatever you want to. What you will find with it when you have it on your desktop is that you cannot change or alter the fields whatsoever. You can only put data into those fields. So if you want to take it and adapt it categorically or by informational field that fits your particular needs, you will not be allowed to do that. It must conform to the standards that provide it. But there's no cost for obtaining it or using it.
Okay. How are individual state licensures dealt with for health professionals?
I'm not sure if I'm the one to answer that question, but let me see if I can tackle that. One of the concerns we have, and this may not be right now in the questioner's line of thinking, but it's what I'm thinking about right now. I think is a real concern. Is number one, the law, the EMAC law, allows for reciprocity. It says whatever one individual is required standards or license or certification requirements in one state, they are recognized by all other member states. And that statement is based on the assumption, and I use that word rather loosely, but I'll have to use it, I have to inject it in there, on the assumption that there are positional standards for individuals across the board, but we know through application that they are not. We know through application that there's a difference in standards or requirements for licensure by some positions across the state lines. And I think overall it would be fair to say that it's not the system's responsibility to try to realign or to align those standards, but it's the profession's responsibility to do that. And that can be done in several ways. Number one, by each state viewing their registry, whenever a particular medical or public health professional is being offered up for deployment, be certain by checking out that state's registry that that individual's license for their position is current and is in good standing. It is the onus under law that each state ascertain those qualities before they send someone out of state. The other, of course, is if there's an expedient movement of professional resources and a check of the registry has not been done or for some reason or other has or will not be done, then making certain that there's a difference in standard of what is being offered as opposed to what is being requested. The difference in those standards are shown on the REQ-A, and both parties understand that if a person with a specific qualification in one state is being sent to another one, but that individual will not be allowed to practice to the full level of that particular standard in the requesting state, that's known before the fact. I know that's a complicated answer, but I'm really trying to answer that best I could. Yes, it is. And it's one I wish that the profession would really look into, because practitioners on the emergency management side are very concerned about how we're going to meet the medical surgery requirements if we don't have more attention to the standards across the board. And I don't know if they can ever be resolved, but that's just one of the concerns I think we challenge with all of us across all discipline lines for future deployment.
Right. I think the use of the registry system helps tremendously. If a volunteer EMS organization wishes to deploy, can the EMS service enter into a memorandum of agreement or contract with their employers to cover their salary and then have that cost reimbursed?
I think so. That is, like the previous question, needs a little bit of little legal study and looking at. What we've said before, when I say we, in all of our discussions about these types of situations where we have private resources being deployed under EMAC. Most of the EMS providers in the country, I think it's agreed, generally agreed, that they are private. They are private for profit, and they have, in most cases, or matter of fact all cases, entered into a legal agreement to perform a quasi-governmental function on behalf of a city or a county, because that city or county chooses to not hire and maintain a professional EMS service themselves, so they hire it out, outsource it. And I think under most of those state laws, in my understanding, that if you are a private for-profit performing a quasi-governmental service, when that governmental entity chooses not to provide that service themselves except through contract, then that private for-profit organization is considered to be a public asset because they're being paid for by public funds. In that case, they can be deployed out under EMAC. Now, the question I have, and what needs to be addressed contractually to the individual that asked that question, is that that contract probably does not include being moved out of state, or maybe even out of that jurisdiction under which they're under contract to provide a standard of care. So if they are moved out of that county or out of that city into another jurisdictional area on an intrastate basis or an interstate basis, it's likely, in order to prevent being in breach, they're going to have to backfill to maintain that standard of care. If they do that, those backfill costs have got to be identified up front and agreed upon by both the resource provider and the assistant in the requesting states. And to make certain that the individuals who are providing that service contractually do have the authority in their contract to leave that jurisdiction. So we've asked all of our counties and our states to be sure to look at those contracts, and as soon as they can be amended to include the authorization to be moved out of state or intrastate basis to be included in that contract language.
Great, thank you, Leon. Well, we have a number of questions that we don't have time to answer today, so what we're going to do is take those questions and supply the answers and send those out to you, and we send you the copy of the PDF of the slides for today. I want to thank you again for joining us. As a reminder, when the control panel is closed, a short 5-question survey is going to appear on your screen. I want to thank you in advance for taking the time to give us your feedback. And again, look forward in your inbox for the PDF version of the slides and answers to some of the questions that we didn't have time to get to today. You'll also be seeing an invitation come in your inbox to the next Public Health and Medical webinar once we have that event set up. Thank you very much for joining us today.